Hi everyone, today we're going to talk about interdental cleaning, specifically the little interdental brushes. I'm going to cover flossing separately. I know that's a swear word for many people, but we're going to talk about it anyway. The reason we talk about interdental cleaning is toothbrushes are great, but they do only get 3 of the 5 surfaces, so we need to get something else in between the teeth. The reason for that is a lot of holes and a lot of gum disease is worse in between the teeth. So we're clearly not, as a nation, getting in there enough. So let's talk a little bit today about cleaning in between the teeth. And again, the more you do it, the better your health is going to be, the less systemic diseases you're going to have. So like I was saying before, there's links to diabetes, there's links to heart disease, there's links to mental health and psychology problems, all from teeth. You know, you start looking at it and the body as a whole. We've really got to take a holistic approach, and I want to help you to keep all of you healthy. We're here to maximise your health, your fitness and your well-being, and this is a really good place to start. Most people brush their teeth, not everyone uses something in between the teeth. The gold standard, the very best thing that you can pop in between the teeth is one of these little interdental brushes. Okay. The reason these are so good is they get into all the concavities as well. So teeth aren't flat. You know, if you're putting your floss or your tape there, it's flat. If you imagine they've got a bit of a bend to it, so if you have a look at the hand like that, if your floss goes down like this, it's not getting into this area at all. And this is especially important when we're talking to people that have got gum disease, you know, the type of gum disease where you lose the bone and you're likely to lose the teeth. As you get the recession as well, as gums go back and recede, more of the tooth is exposed, which shows more of the root patterns. In the crown part of the tooth, which is the part of the tooth that you see in the mouth, there's also different concavities and things. So we need to make sure we're really getting in there and keeping them clean so there's no stagnation areas. And when you don't get any stagnation because you're getting rid of all that bacteria, you're getting rid of all that trapped food, lots of things are going to improve. You know, you're not going to get huge amount of bacteria, you're not going to get the holes and decay, you're not going to get the gum disease and the bleeding gums, you're not going to get the bad breath. So plenty of reasons, and I'm hoping I'm convincing you, to get something in between the teeth. So as we can see from my lovely model here, this side is nice and red where gums haven't been looked after so well. This is the kind of colour that we do want the gums to be. We want a nice light pink, we want them to be nice and firm, a little bit of stippling there, and we don't want them to bleed. Any bleeding from the gums means there's a sign of gum disease. Now it may just be gingivitis, which is inflammation of the gums to a point that it's not losing the bone, or it could be something called periodontitis, which is a more significant and severe type of gum disease, which again quite a lot of the population is prone to. So we need to make sure that we are doing everything to keep our mouth healthy, keep our teeth for longer, and making sure we have no active gum disease. When you're looking for an interdental brush, you really want one that's going to fit snugly into the gap between the teeth. You don't want one that's too small because that's not going to clean the area very well. You don't want one that's too big because then obviously you're not going to get the brush in there. So you size it up for the gap. And I'm going to go for the yellow one for this one. And if you have a little look, what you do is you right down at the gum level, you pop it in and you push it through and give it a good wiggle. Can you see how it actually comes out the other side as well? Okay, and you can give everything a really good wiggle in there, but it's a nice kind of fit. You can feel that those bristles are really touching the sides of those teeth. And as I say, if I show you from the other side, you can see how those bristles are going in and out, all those different concavities. And you can even use it and move up and down a little bit, really getting in there as much as you can. When you're doing all your interdental brushing, yeah, the front teeth's really easy, you can get to those no problem. But when we're trying to get to the back teeth, you can get ones with longer handles, but you also, and this is my top tip for the day, do the opposite of what you think you ought to do. So most people try to get to the back teeth by opening as wide as they can, which pulls your cheek right tight close to the teeth, so you haven't got the space to get in there. Instead, if you're trying to do, say, the top tooth at the back here, close up, swing your jaw to that side, say, and that makes the side of your cheek go really flappy. It gives you all the space to get in there and clean in between those back teeth. And when we come back, one of the things that we really want to do is get some tailor-made oral health and hygiene and instruction plans done with people. We would like to size you all up for these tepe brushes so that you've got the option, if you want to use them. The reason that we talk about them, why Sarah and I are so passionate about cleaning in between the teeth, is we've seen it. The years that we've been practicing, and I mean, I've been working in dentistry for a very long time now because I started as a dental nurse, as many of you know. So going like a long time, 18 years in fact, I've been working with teeth in one form or the other. And I've seen the results of it. I've seen the difference they can make. I've seen how much this build-up are coming through, how much better the gum disease is, how I'm not doing so many fillings, or how when I worked with my dad, we weren't doing as many fillings on anyone that was using these interdental aids. So we really are passionate about oral health, oral hygiene, and I know a lot of my patients I've already looked at tepe brushes with, but then I want to just go at it again. We're going to start from the very basics to make sure that if this ever happens again, and I really hope it doesn't, I know that you've all got all the ammunition in your arsenal to go out there, keep on top of all your oral health, which is going to, again, keep on top of your physical health and your mental well-being. So it's really important to do that. And it all comes down to a little brush.